There's the homeless you see living on our streets, like in downtown Bakersfield. But then there's the homeless living in places like this, calling out for help, unheard and unseen by many in our community.
Hey, good morning, man. How are you?
Tucked away in southeast Bakersfield.
How long has this been going on?
About a week.
Living in the shadows.
Any fevers that you've noticed?
It's an unlikely place for a medical clinic.
I could send it to a pharmacy if you have insurance. If not,
These cotton gins are abandoned by the rest of Bakersfield, but frequented by the street medicine team from Clinica Sierra Vista.
giving out condoms, syringe exchange, hygiene kits. We try to provide dog food.
Every Thursday morning, they hit the streets, walking miles by the river in Oildale, looking under bridges, checking in on routine patients.
A lot of wound care, a lot of infectious disease, things like hepatitis C, HIV, syphilis, that's very prevalent in the community.
All of the care free.
I think they actually gone above and beyond.
And the key to the team's success,
Building relationships with this population so they know that we'll be there the next week and we can provide the services that we have been providing. It's good to see you. Yeah.
like with CJ, who fell on hard times after his mom died.
Statistically, the life expectancy of someone who's unsheltered is about a third of that of someone who is sheltered, and that's a significant risk to immediate well-being.
It's a problem plaguing all of California, widespread homelessness.
Housing is very important. The city of Bakersfield, the county of Kern, we're addressing housing, but we must address the root issues: substance abuse, mental health.
While the city waits for a new low-barrier shelter to be built, street medicine is boots on the ground.
It's striking to me that the population feels like they're sort of invisible, even though they're our neighbors and they've been in our communities for years now.
All of this done on the team's own time, on the clinic's own dime.
We have funding for emergency shelters, but we need reform in the Medi-Cal system so that we can actually address some of the root issues and make substantial long-term systemic changes.
In the meantime, short-term change comes with compassion.
It's easy to forget that you're talking about human beings. You're talking about people with the same aspirations, the same goals, the same dreams that we all have, and they've just been marginalized and set aside and seen as almost subhuman.
I want to see a fulfillment to my own personal research, but I want to invent for people.
Dr. Baer hopes other local doctors will take the initiative to start their own street medicine teams.
So you always got to have hope. Hope's part of love. If you got love in you, you got hope.
Now the question remains, will our elected officials also see the value in this and offer financial support for their endeavors? In Southeast Bakersfield, Karen Hua, 17 News.